Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I'm pleased to be joined by Janis Isaman. Janis is a trauma-sensitive movement specialist at My Body Couture in Calgary. She specializes in movement and exercise and understanding the body and sensations as part of the therapeutic process. Please welcome to the podcast, Janis.
Hello.
Thank you for being here. I always start with really brief introductions because I'd love to give you an opportunity to explain more about your professional background and what you do.
Yeah, thank you for that. So I am a trauma-sensitive movement specialist. And so what that really means is that I'm combining movement, and some of those modalities are what we used to call mind-body disciplines. But importantly, I have 5 different trainings and certification in trauma. And one of those is trauma-centered, trauma-sensitive movement, which is a little bit of a mouthful, but that is an evidence-based practice, an evidence-based course that comes from the Trauma Center, which is Bessel van der Kolk's home base. And so about 20 years ago, he was looking at integrating yoga into his clinic. And that's really the root of that work. So it has always been something that's been really clinically studied, clinically investigated. And what's amazing about it is that we know the mechanisms that are effective in a trauma-exposed populace because of that. So we have 20 years of data, and there are now some really exciting studies that show that it is as effective as talk therapy for that, for that trauma-exposed populace. So this is a great modality, either to be an adjunct with therapy or to be something for somebody who maybe is treatment resistant or doesn't want to discuss their trauma exposure verbally. We know that trauma sits in the body. So what I do in my practice is I use that modality. I do shy away from the word yoga because a lot of people kind of have a lot of connotations about the word yoga. But I also have other modalities that I trained in as long as 20 years ago. And I'm taking those same principles and infusing it over top. So depending on that level of trauma exposure, we're either using a really pure form, trauma-centered, trauma-sensitive yoga practice with somebody, or we might be infusing other kinds of movement with some of those principles on top, just depending on where someone is in that process and what the therapeutic referral is.
Okay, so I do have a couple questions about what this looks like because when you first reached out, I hadn't heard about something like this. However, there's been a lot of conversations that we've been having sort of in a similar realm. But specific to what you're doing, can you kind of give an example of what somebody's first session would look like with you? Like, are they coming in and explaining to you what their trauma story is, or do you even need to go there? Like, just give me an example of what something could look like.
Yeah, that's a really good question. So I do get a lot of referrals from therapists. And in that case, I know that they're working with a therapist. So I do have training, a different modality to sit and have conversations with people who have trauma. So I am trained and certified to do that. But typically when I have somebody that's referred in by a therapist, we're not going to cover that component because they're already doing it. So a lot of those referrals from therapists happen because that person is unable to really access the body. So I will get people that, when the therapist says, what sensations do you feel? Where do you feel it? Often they either can't access that information, or it's a really detached, almost wooden description of what it is, or they jump from their body into their brain, and they kind of can't have that duality of addressing both at the same time. So that's kind of the common referral. If somebody self-refers, it depends, to be honest, on about whether they want to talk about it or not. So again, I have the capacity to have those conversations. I do find quite typically, to be honest, that a lot of people in my practice don't want to, because if they actually felt really called to kind of chat it out and do it verbally, they probably would choose a more traditional therapeutic path. So what I'm really working with is people who their trauma is really in their body. It's impacting their physical comfort, it's impacting their movement, maybe it's their body weight, maybe it's some of those coping strategies really around the body where they can't access all or part of their body, and they recognize a need to feel better in their body and to actually have a more integrated experience. So it kind of looks a lot of different ways, just depending on who it is, how they're coming in the door, what level of trauma exposure, and what their comfort level is with that.
That's great. So you kind of alluded to this a little bit in your intro, but I'm wondering if you can expand a bit on what the research says about trauma sensitive movement.
Yeah. So a couple of things, actually, I just want to clarify because there is a big conversation about what's the difference between trauma sensitive movement and trauma informed movement. So we'll often see kind of trauma informed popping up, especially in yoga contexts. So at this moment in history, and this isn't kind of across the board, I can't speak to other kind of modalities, but within the movement sphere, trauma sensitive is a trademark terminology. So if you encounter somebody who is a trauma sensitive facilitator like myself, that means that we have done that really specific training through the trauma center, trauma sensitive yoga. So that is what that means. So within that, we have really specific things that we're offering and ways that we offer it. We have to actually renew that certification every 2 years, et cetera. So there's continuing education credits that we have to get, et cetera. Trauma informed is not a regulated term. So anybody, to be quite frank with you, could be a trauma informed yoga teacher or movement practitioner. You can do that through things like listening to podcasts, taking a course. It might be part of your training, et cetera. So I always like to share that. It doesn't mean that trauma-informed practitioner is not a great practitioner. It doesn't mean that they're not offering great principles and not helpful. It just means that there is no kind of regulatory term on that, whereas trauma sensitive is trademarked and it means really specific things. So some of the things that actually means, we know from the research that one of the biggest elements when it comes to movement in our bodies is choice. Now, that's a really simple word, but that means that every piece of movement that is being cued comes with an element of choice. So we know that a trauma-exposed person often has lost choice over their body. So that is one of the hallmarks quite often of trauma exposure. So we're giving people choice, and that is usually quite a different element when it comes to movement, especially for women who have gone to traditional exercise classes and courses and programs where we're told what to do with our body, how it needs to look, etc. So that's a really big piece of it. Within that, there's something called taking effective action, and that's where within that choice, we can make that decision of what feels effective in our body. Another core element is going to be, excuse me, I'm so sorry. So another core element is going to be where we are able to have what's called interoception. So when we're trauma exposed, we often lose sensation in all or part of our body. So we know that a trauma exposed person often dislikes their body, can't feel their body, can't connect to their body, etc. So that's really one of the hallmarks quite often of somebody who has had a traumatic experience. So we use something, this is a term also used in more traditional therapy, but dosing and titration. So what we're doing as practitioners is we are assessing where somebody is at and then cueing them to feel their body. And that can be either quite specific or it can be quite general. And so depending on the level of trauma exposure, we might do that once or twice in a whole hour, or we might do it really frequently. So we're cueing people to kind of dive into some of those sensations and connect to the body as part of their whole experience. So it's not something outside of them. It's not the arm. It is our arm. It belongs to us. We are in our body, and kind of reintegrating that experience of what it means to be one with our body. And that one I find is actually some of the most challenging work that we do, because when we have that trauma exposure, often we just want to hop out of the body. So that's where really, again, working with someone like myself, we are used to people that dissociate, for example. So where we can see somebody doing the movement, but just completely their brain has left the room. And we're trying to work with triggers, and we're trying to work with all of those pieces where somebody is going to cope around not having to feel themselves.
I think it's also really important for us to just reiterate where you said the training came from, because Bessel van der Kolk is really like one of the godfathers in the
Yes.
trauma space. Like
Yes.
the body keeps the score is kind
Yeah,
of the Bible that consistently gets referenced
it
every
is.
single podcast that we've ever done. So I think just
Yeah,
having that be really key, that this training comes from a
yeah.
really solid foundation is really important for sure.
Absolutely. And I think that that's, I mean, that research component. So whenever I talk about kind of those research based elements, they sound so simple that it seems like, oh, anybody could do that. But you're absolutely right, where the kind of underpinning was Bessel's work identifies, I would say that the summary of his work is that the body is really holding those traumatic experiences, and it's not stored in there like a pirate's treasure chest. But what we do know from his work is that one of the keys to integrating traumatic experiences is through the body, because that's how we experience everything. That's where all of our sensations and movements exist. That's how we literally take in and give output to the world. And so we know that art, movement, dance, things like that are actually super helpful. Another core element that I didn't mention is rhythm. So that ties a lot of those pieces together. We know that just rhythmic movement of the body is helpful. So I think it was about 21 years ago, he started working with yoga as a component. And we've always had research behind this. Now, research, as you know, takes decades to kind of come out with a proper paper. So we had our first paper that was published in JAMA in late 2023. And the other element with research is that it's often on a really specific population. So that paper studied female US military veterans and looked at the difference between cognitive behavioral concepts versus our trauma sensitive yoga, and they were shown to be as effective. So that's a really thin slice of a population, but quickly behind it on its heels, there is another study with male youth, so they're teenagers who are incarcerated in Georgia. So again, we're still talking about an American population, but it's a different slice of people, and we're showing the same results. So we're going to see more and more of these papers coming along, because it takes so long to get that research. But that's where we're kind of plucking out these elements like rhythm, choice, taking effective action, etc. They're not just kind of made up out of thin air, or much as it seems really simple in its intellectual concepts. I find a lot of people are looking for something that's more complex. That's the underpinning of how and why and where those came from. And it's because from day one, that was part of the whole mission of that institute. And I do want to mention at this point, actually, Trauma Sensitive Yoga, although it still has that title, it is now a separate institution.
Got it. Okay, perfect. So for somebody who is maybe new to the concept that trauma can live in the body, and maybe they
Yeah.
haven't traditionally explored that, how would someone listening to this podcast know that the type of work that you do would be beneficial for them?
That's a really good question. So there's kind of a few things, and it's certainly not going to be everything, but we dislike our body. That's a big one. So if you're somebody who, and That's a tricky one because it can come from other places, but that can be a hallmark of trauma exposure. So just really feeling disconnected or a lot of distaste towards your body. And to be clear, we all kind of have some things that we maybe wish were different, but it's the finding your body gross or disgusting or hating it or just not being able to come to peace with your body, not being able to feel your body. So where we have a sense of my brain is running my whole setup and everything is processed through the brain. Again, that becomes really tricky to self-identify quite often because our culture really focuses on the brain and intellect and all of those elements. But things where we have a sense that we're just not, we're not integrating our brain and our body. Eating disorders, exercise disorders. If your therapist is actually saying to you, can you, what do you feel in your body? And you just you want to dive out of that question.
Right.
I often find, so a lot of my clients have kind of two hallmarks. They're either in pain. So we have chronic pain. Chronic pain is not always caused by trauma, but it can be. Right. So things where you've gone to the doctor, you've investigated it in some other way and there's kind of no root cause, nobody knows why it's there. That can be a really big signal. We also might get people who are oversensitive in their body, so they feel everything. Conversely, we can get people that dissociate from their body. So if you have no joy of moving your body, no joy of exercise, no joy in kind of going for a walk or anything related to your body, that's usually kind of a big sign. So you don't have to be coming to me because you know that you have this big trauma exposure necessarily. Or maybe somewhere in the back of your mind, you do know, but you don't feel like going to trauma therapy. Those are just a few of the different pieces. And I would say another one is where you're physically present places, but you feel like you can't be emotionally present. So that one comes up a lot where people are just kind of, they're a body in a room thinking about the future or ruminating about the past, a lot of anxiety, things like that.
Okay, that's super helpful. So, if someone's going to come to you, is there a rough estimate? It's always an impossible question to answer, but I'll ask it anyways. How many sessions would somebody be looking at if they were going to come to you?
Well, that's where actually, because again, we do have we have those clinical studies. I actually do have an answer. So the clinical
Amazing.
studies are based on 10 sessions. So it's 10
sessions, okay.
1-hour sessions. And essentially what we know happens during those is that we get the experience of connecting to the body, even if it's for short windows each session. We get the experience of choice in the body. We get the experience of rhythm. We get the experience of being able to make decisions over our own body. And what has happened time and time again with my clients, either in privates or in group settings, is that people get a taste of that and then they go out into the world and they repeat it because it's a positive sensation for them. It's a positive experience for them. And so it's really common after the second or third session that people will report to me, oh, I did this outside the session. I experimented with that outside the session. And that's what we really want. We want an experience where people are not tied to me as a practitioner or tied to any practitioner in this realm, where they can discover connection to their own body. They can discover that reintegration. And so we know from the research, which is so great, that 10 sessions is kind of your hallmark. Now, I have worked with people for fewer sessions than that, especially people who have physical pain, and that's okay. So we don't necessarily, I don't tie people to 10 or nothing. But we know from a clinically effective standpoint that that's kind of our wheelhouse of benefit.
Amazing. That's super helpful, actually. Okay, this has been really important information on exactly what this looks like. So that's great. I want to shift the conversation a little bit more to you personally, starting with, how did you get into the type of work that you're doing now?
Yeah, I think that I have a really simple answer to that. That of course is more complicated again than it seems to be, but I do what I needed in my own body, in my own experience. So, back when I first got into this, we didn't really use the word trauma. That wasn't part of the conversation. But I had some body pain myself. There was things that didn't make sense. I always kind of had a lot of the things that I've shared in a client that might be benefit from this. And so I started that personal inquiry and discovered some pieces, especially with exercise, that really regulated my mood, that helped that body pain, etc. So that's where I started. It was really tactical, really bones, muscles, joints, movement, all of that stuff. And then as I moved along the path and started working professionally, I noticed that often as we started to do this body work and movement work, that people's traumas would kind of reveal themselves in front of me. And I'm sure that many massage therapists and other body workers could relate to that comment. And so at that point, I really started a hunt for, okay, how do I work with this component? Luckily for me, Gabor Mate is a Canadian, and I went to see him and I asked him, who is merging these two pieces of work? And he said, I don't know. So he invited me to train with him, and I actually did do that. And that was kind of really the beginning of cracking some of this open. Now, Gabor isn't a movement specialist per se, but he really does work with the body. He's really big into, somatization of how things manifest. And so that became kind of my underpinning for looking for this work and for starting this work, and really recognizing, trauma is an experience of the body. And so then after that, I subsequently added a bunch of, additional trauma pieces. And they were so transformative in my own body, because as a practitioner, when you go through these trainings, the number one piece is we cannot work with trauma exposed people if we are bringing our own traumas to the table. So you have to do your own work in your own body. So every single thing I teach is something I have done myself and continue to do in my own practice. And so I know firsthand how much it's changed my own experience of my body. It wasn't until I did some of those trainings that I realized how much I dissociate and get triggered and all the things. So, I mean, it's been a 20-year pathway to kind of get here. And each layer is just so transformative for me personally, as well as for clients.
That's amazing. Huge Gabor fan, obviously.
Yeah, he's awesome.
Yes. What's your favorite part of what you do?
It's helping people. It's amazing to me when people come in the door and they have a starting point, and just watching them blossom. And honestly, it happens so fast, because I think when we think about trauma experiences and trauma exposure, you think it's this big, heavy, long process. And within 3 sessions, it's like I have different clients than the day I met them. And it's amazing to hear the stories of the things that they have done outside of our sessions, watch them blossom, watch them come to life, watch them really kind of experience their life in a different way. I just love it so much. Like, I deal with people who want to be there, who want to be doing that work, who are embracing the experience and just really changing their lives. It's the best job ever.
That's amazing. Do you have any favorite trauma resources that you like recommending?
Well, we definitely would put Bessel's book onto the roster.
Yes, absolutely.
I would actually also, although it's kind of a little bit less commercially popular, Gabor's books as well are amazing. That was actually a huge entry point. I mean, I went to see him because I had read his books, and there's a few of them that are a little bit older at this point, but The Myth of Normal is a brand new book, and it's really quite a comprehensive look at trauma and how we as a collective society kind of got here. I really also love Peter Levine. I've taken some training with him, so he has a huge library of books. They're a little bit heavier, but you can't go wrong with Waking the Tiger. And then actually I'm a big fan of Stephen Porges as well. So I would go podcast with Stephen Porges as opposed to, I don't know if you've ever tried to read the polyvagal theory book. It's pretty dense.
Yeah. Yes.
Yes. So I think I see a lot of kind of somatic conversations when it comes to trauma, talking about the nervous system. And we could go onto TikTok right now, and that would be one of the first things that kind of pops up. Stephen Porges is kind of the root of all of that material. He is incredibly gifted at sharing that information, and when he is in spoken form, I think there's nobody better as a resource to kind of learn a little bit about your nervous system. So I'm gonna pick the four godfathers. You have your Bessel van der Kolk, Gabor Mate, Peter Levine, and Stephen Porges. And I'm biased because I've taken coursework or training or certification with all of them, and they're all amazing.
I mean, you can trust it because those names come up every episode. So a lot of people feel the exact same way. So it's good resources for people to check out for sure.
Yeah, for sure. Yeah.
This has been an amazing conversation. Is there anything else you would like to share before we close?
I think that really I present to a lot of therapists, and I say a sentence that everybody agrees with. So no therapist has ever challenged me on it or said, no, I don't agree. But I really, really, really feel it's important to share the message and spread the message that we cannot rid our body of trauma by sitting still in a chair, period. So we have to move the body. That is part of the experience of being human. It's part of the experience of being alive. It's part of the experience of moving trauma through the body. When we think of exercise, a lot of people kind of are like, oh, I don't want to go to the gym. I don't want to do. That's not what we're doing. We have to move our body. That is how we live as human beings. So I just want to kind of leave people with that messaging. Therapy in a traditional setting is amazing, incredible. I work with a lot of therapists. I recommend therapy, but we cannot start and end the process sitting in a chair. We have to move the body. So if you're struggling with that component of it, I'm a great, adjunct practitioner, clinician to help you with that. If you feel like you're not ready for therapy, I am a great practitioner, but really planting that seed in your mind that we will never fully rid the body of our trauma exposure by sitting in a chair. We have to move.
I think that's an excellent note to end on, actually. Thank you, Janis, so much for being on the show today. If anyone is looking for more information about her and her practice, you can see our show notes.
Thank you.
The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.